my name is Jay. I'll be your nurse today. Can I go ahead and ask for your name and identification, date of birth? Okay, great, Mr. Patient. Well, today we're going to be inserting a nasogastric tube. It's going to run from your nose to your stomach to put in or out anything you may or may not need. Before we do that, I'm going to go ahead and provide us a little bit of privacy. I'm going to wash my hands. Okay. Now I'm going to raise your bed to a working height. Which for me might take a second. Okay, great. Now I'm going to raise the head of the bed to 90 degrees or high Fowlers. Okay, I'm going to go ahead and check the nair and see which nair is most patent. Okay, breathe in for me. Okay, breathe in for me. Right nair is patent. Okay. Alright, and now I'm going to go ahead and put a lens saver over the top of you. Now I'm going to prepare my equipment. I'm going to get my tape ready. Add the syringe to the nasogastric tube. I now will apply clean gloves. I'm now going to begin measuring the nasogastric tube. I'm going to go from the right nair to the earlobe. Okay, and from the earlobe to the xiphoid process. I'm going to mark that with a piece of tape. Okay, now that we've marked the length, I'm going to go ahead and coil it around my finger to kind of take away some of the rigidity of the tube. I'm going to go ahead and give you a cup of water. So while you're swallowing, in case you need it, you can swallow some water. And I have a basin right here in case you get sick during the process. Now I'm going to lubricate the tube. Lubricate the end of the tube. Okay, now if you would, go ahead and tilt your head back. I'm going to tilt the head back through the nasopharynx. reach the back of the nasopharynx, I'm going to instruct the patient to swallow. Okay, sir, swallow for me. Great. Swallow, swallow, swallow. No signs of respiratory distress. Swallow, 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 swallow. Okay. Okay. Now that we've got it in, before I secure it, I'm going to verify placement of the nasogastric tube. That's a temporary tape. Okay. One good way to check placement of the nasogastric tube is to ask the patient to speak. Sir, how are you feeling? Okay, great. Another good way is to look in the oropharynx and make sure there's no coiled tube. Okay, no coiled tube in the oropharynx. Now I'm going to actually aspirate some gastric juices, about 5 milliliters. Okay, gastric juice is green in color. Now I'm going to remove the syringe. And clamp the tube. Now I'm going to check the pH of the gastric juices on the litmus paper. Okay, gastric juices are within normal range. Okay, now that I've verified placement of the NG tube, I'm going to secure it to the patient permanently, well, temporarily. Okay. Okay, we have nasogastric tube secured to nose, and now I will secure it to the patient's gown. Give them a little bit of slack. Okay, now the nasogastric tube is in place, I'm going to get rid of my equipment. Let's see. Going to remove my gloves. Remove gloves. I'm going to wash my hands. I would have removed this previously. Alright, and then I would use a doctor's order to verify to get an x-ray. Let's see. Actually, I would lower the head of the patient's bed to 30 degrees. Okay, head of the bed at 30 degrees. Lower the bed back down to the floor. Okay, place the call light by the patient's bed. Then I would get a physician's order to use an x-ray to verify placement of the nasogastric tube. Then I would document it in the electronic medical record for the patient. I inserted a nasogastric tube into Mr. Patient here. I aspirated gastric juices. They were normal in color, pH was normal in range, and I have sent off for an x-ray to verify placement. Okay. Now for removal of nasogastric tube, I'm going to introduce myself. Hi, my name is Jay. I'll be your nurse today. Can I go ahead and verify your name and date of birth? Okay, great. Alright, today I'm going to be discontinuing your nasogastric tube. Before I do that, I'm going to go ahead and provide us a little bit of privacy. I'm going to wash my hands. Okay. At this point, I'm going to go ahead and put a linen saver on the patient. Apply gloves. Remove my tape. Let me prepare my equipment and get my tissue ready first. Okay, I have a tissue in my right hand. I'm going to remove this tape from the, starting with the patient's gown and from the patient's nose, and holding a tissue with my dominant hand, I'm going to steadily pull and instruct the patient to hold his breath. Okay, hold your breath, sir. Okay, great, 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 great. I'm going to wrap the end of this tube in that tissue and put in my red biohazard bag. Okay, there's a gastric tube and red biohazard bag. Okay, now I would clean the patient's nose, remove my gloves, perform hand hygiene, go ahead and provide the patient with a warm washcloth for hygiene for himself, and then I would document it in his electronic medical record. I'm going to lower the head of the bed. Let's see. Lower the bed back down to its normal level. And there you go. Your nasogastric tube is discontinued.